Say hi, guys.
What's up with it?
Imagine you were eating at a restaurant with your family. You decide to go use the restroom. On the floor, you notice that there is an unresponsive patron. You take a little further look into it and you discover a pill bottle. Now, using our inference clues, what do we think? An overdose. An overdose is the overconsumption or ingestion of prescription drugs over the recommended dosage. According to the World Health Organization, August 29, 2023, during the year of 2019, there were over 600,000 drug-related deaths. 80% of those deaths were opioid-related overdoses. Now, this subject is very personal to me because a couple years back, I lost a friend to an overdose. And I'm sure everyone in the audience knows a celebrity that has died from an overdose. Now, just imagine if that was one of your loved ones. What would you do? Would you know what to do? Well, lucky for you, that's what we're going to learn today. Today, I will be informing you of all the opioid overdoses by explaining the rise and dangers of current opioid epidemic, signs and symptoms, how to identify them, as well as how to treat someone you suspect may be overdosing. Opioids are prescribed for treating immense pain, but they can also be abused and they are very addictive because they block the pain receptors in your brain and they have a really good feeling. Some of the most common opioids are morphine, oxycodone, fentanyl, and tramadol. Fentanyl is especially addictive because it is 100% more potent than morphine and 40% more potent than heroin. Fentanyl is one of the leading causes of opioid-related deaths because a lot of drug dealers, they cut it with other drugs. So if you think that you're buying cocaine or heroin, it could possibly be fentanyl could possibly be incorporated into it, making it very, and because of its high potency, it can make it the fatality rate is very high. Now that you've learned the rise and dangers of opioid-related deaths, it is time to be able to learn how to identify the signs and symptoms of someone that could be going through an overdose. As mentioned on Medical News Today, July 19, 2021, they use the acronym BLUE to identify someone who is maybe having an overdose. B stands for breathing. You want to see if they have shallow breathing or no breathing. L, they may have pale lips, pale, blue, or purple. U is for unresponsive. Is the person unconscious? Are they unresponsive? Have you tried tapping them? Do they respond to you tapping them? Do they respond to you calling their name? And lastly, E is for emergencies. If you notice that all of those things were yes, then call 911 immediately. Now that we have learned about the signs and symptoms of an overdose, it's time to go over the treatment for overdoses. There is only one apparent treatment for overdoses, naloxone, also known as Narcan. Narcan reverses the effects of opioids. There are two forms of Narcan, nasal or injection. Narcan blocks the brain's opioid receptors as well as counteracts the depression of the central nervous system that the opioid causes, as found on BU Today, October 23rd, 2024. Today, I've informed you of opioid overdoses by explaining the rises and dangers of opioid use and how to identify the signs and symptoms of it, as well as how to treat suspected overdose victim. The opioid epidemic caused almost 1 million American lives of all ages in the past years. To make change and awareness, I brought you this information so you can learn, how to identify someone or help someone if you find that they are overdosing. I hope with the information I provided today, you know what to do if you find someone who is struggling with an overdose.